number of COVID-19 cases continues to rise globally and right here in Guyana. Therefore, we encourage everyone to practice social distancing, wear a mask if you have to leave your homes, and wash your hands thoroughly and frequently as we strive to flatten the curve. Welcome to InfoHub for Thursday, May 7. Thank you for joining us. The national recount of votes cast at the March 2 general and regional elections continued today at the Artichoke Conference Center. Senior Communications Officer Felicia Valenzuela was there and brings us the details.
The national recount process started on time earlier this morning, according to Minister of Public Infrastructure David Patterson, with regards to issues raised yesterday by APNU AFC agents about ballot boxes specifically and about a deceased person's name being on the list. Minister Patterson says he hopes these issues will be resolved soon.
They were more efficient, so we started on time at 8 p.m. So they had to cut a lock on tick on the East Bank container. So it started on time. All the agents were there. The process is going. I know that initially we had a bit of an issue because somebody was live streaming early this morning on GCOM, and I think persons once again raised their voice. You probably will hear that again. It'll come out again. But GCOM stepped in very quickly and resolved that. So we have streamlined our process as well, so I'm waiting to hear from my agents when this first rung is finished.
Later on, Minister Patterson spoke with the media again. This time he spoke of some concerns the APNU AFC is having with a meeting that was allegedly held between a GCOM staff and a party agent.
When you have a process and everybody must follow the process. I can recall, you can recall that the opposition are complaining that if the SORs are in the possession of the CEO, they don't want that. Just like us, we don't want any party speaking to the IT manager. Actually, we've asked formally for them to rule on it, and you haven't replaced it. Several IT managers in GCOM, IT persons in GCOM, haven't replaced it. If somebody would like to raise an objection, there's a certain format in which you can do it, and we hope that everybody respects that format.
The Public Relations Officer of the Guyana Elections Commission, Ms. Yolanda Ward, also briefed the media on what took place on day 2 of the national recount.
We would have completed 14 boxes as of now. As you know, yesterday our total was 25, and of course we got off to a late start yesterday. Every box, the number of ballots in a box vary. As you know, the order is a legal document. Whatever is in the order is what we need to follow until such time when a decision is taken for that, anything else other than that to be changed. As we speak, the Commission is currently meeting to discuss that particular issue, and so when they arrive at a conclusion, if there are amendments to be made to that order based on their decision, that will be done.
We're going to continue to bring you more update on what's taking place at the Artichoke Conference Center. For now, I'm Felicia Valenzuela here with my videographer, Akeem Thomas.
In oil news, engagements between the Government of Guyana and Esso Exploration and Production Guyana Limited continue for the finalization of the Payara Field Development Project. Hear more in this report. This was disclosed by Director of the Department of Energy, Dr. Mark Baino, on Monday during a virtual media conference.
The review of the Payara Field Development Plan is fairly advanced, with some preliminary issues raised with the operator. The Department of Energy continues to engage with the operator in a collaborative manner before finalization of the comments to be shared and the draft license to be drafted.
He explained that a list of matters to be addressed has to be provided before approval is granted for the field development project.
The Payara Field Development Plan process is not held in abeyance. We continue to work through the process as we align what needs to be aligned, so by the time the political furor is sorted, we can be able to take it forward to say one way or the other what the course of action ought to be.
This, he said, is not unusual, as a similar process was followed for Liza Phase 1 and Liza Phase 2 projects. The review process for Payara commenced last year after ExxonMobil submitted the FDP. Payaro will be the U.S. oil giant's third project in the Stabroek. Senior Communications Officer Isaiah Braffett on Wednesday evening rode along with members of the Guyana Police Force as they carried out their daily curfew enforcement activities around the capital city. Let's take a look.
On Wednesday evening, InfoHub rode along with the police patrol to get a first-hand look at their enforcement efforts amid the COVID-19 pandemic. Two men were picked up by the police as they patrolled the city for their failure to adhere to the curfew. The men were arrested on the bus parks. The individuals are just a few of the many persons who have been arrested by the police for failing to adhere to the 6 p.m. to 6 a.m. curfew implemented to help curb the spread of the deadly coronavirus. The men were taken to the Breakdown police station where they were placed on bail and given a date when they have to attend court. The daily enforcement of the curfew by the police is especially important as many persons continue to disregard the emergency measures implemented by the Public Health Ministry. As of May 6, Guyana has 93 confirmed cases of the coronavirus with 10 deaths. While there have been 27 recoveries, adhering to the curfew is crucial to slowing the spread of the virus. The Guyana Police Force continues to call on persons and businesses to adhere to the emergency measures. They are also reminding that any person who fails to comply with any of the measures commits an offense under Section 152 of the Public Health Ordinance and is liable on summary conviction to the penalty provided under that section. Isaiah Braffett for InfoHub.
More news after this short break. Stay with us.
A face mask only works if it is put on, used, and removed properly. This is a surgical mask. Before putting on a face mask, you must wash your hands properly with adequate soap and water for at least 20 seconds, or use a hand sanitizer with 60% or more alcohol. Before putting on your face mask, you should also check your mask for holes and tears. And remember to identify the top of the mask. The top of the mask has a metal strip. Put the mask on by holding the two elastic loops. Place one loop on one ear at a time. Pull the bottom of the mask to cover your mouth and chin. Place the mask over your nose. Pinch the stiff edge of the mask to the shape of your nose. Remember, do not pull down your mask while in use. Do not touch your mask while in use. If you do, please wash your hands immediately. To remove the face mask, hold the elastic loops from the back of your ear, pull them apart, do not snap, and pull it downwards. Then place in a bin with cover. Do not forget that as soon as you take off that face mask, you need to wash your hands immediately. Also, replace your mask once damp.
Thanks for staying with us. Some good news. Stringent efforts by the Guyana Police Force has led to the recapture of 11 of the 12 inmates who escaped the Juvenile Holding Center on Tuesday, May 5. This was confirmed by the police force in a press statement issued earlier today. The remaining juvenile on the run is on remand for murder. The police said during the escape, 2 police officers were assaulted and have since received medical attention. Those police officers who were unarmed were relieved of the keys to some of the other cells. A thorough investigation is underway into the circumstances surrounding the escape of the juveniles. More COVID news. As more countries contemplate how to lift lockdown restrictions, the World Health Organization has recommended criteria for nations to consider. Details in this report.
WHO Director General Dr. Tedros listed the 6 criteria that countries must consider when lifting the lockdown restrictions implemented as a result of the COVID-19 pandemic. Surveillance must be strong, cases are declining, and transmission is controlled. Health system capacities are in place to detect, isolate, and test every case and trace every contact. Outbreak risks are minimized in special settings like health facilities and nursing homes. Preventative measures in place in workplaces, schools, and other places where it is essential for people to go. Importation risk can be managed. Communities are fully educated, engaged, and empowered to adjust to the new norm. Dr. Tedros noted that the risk of returning to lockdown remains very real if countries do not manage the transition periods extremely carefully and implement a phased approach. Additionally, the WHO, UNICEF, and the Red Cross have published guidance for countries on how to maintain community based health care in the context of COVID 19. It includes practical recommendations for countries on sustaining essential services at the community level, leveraging community health workers for the response to COVID 19 while keeping them safe, and advice for how to adapt services for specific diseases and age groups. Seneca Thorne, InfoHub.
As Guyana continues its fight against COVID-19, contact tracing is very important, as it is used to break the chains of transmission and prevent surges of cases. In this next video, the Ministry of Public Health explains how contact tracing works.
My name is Sasha Walrand, epidemiologist and head of the Epidemiology and Surveillance Unit at the Ministry of Public Health. So we're going to talk about surveillance. Now, surveillance is a systematic way in which you go about collecting data. Once you've collected it, you will analyze it. And from the analysis, you're going to interpret it. That's going to help you in terms of planning Guyana's response and to improve implementation. Once we've been notified, or once we found a possible case, then that person is contacted and contact tracing is done. Meaning we try to find as many persons who would have been in contact with this person for up to 14 days or 2 weeks. And within that, every contact that is given to us, we will also call those persons to gather information about those persons, and follow-up is done, just to ensure that how they're feeling, if any changes in terms of their symptoms and so forth. Once symptoms have changed and they've been red flagged, meaning that, for example, they've presented with a fever, or somehow they've had a cough or sore throat or any respiratory problem, then we would relay that information to the clinical coordination team. The clinical coordination team will do further assessment, and based upon discussions also with the Epi Surveillance Unit, recommendations for testing is also a possibility. If by chance, during the time span in which we're following up, and the person would not have developed any symptoms, upon the end of their follow-up, their names are provided to the healthcare facility, for example, Georgetown Public Hospital, where persons can be given their clearance. And upon the clearance, they'll be further assessed by the health institution. The more truthful persons are when we speak to them, because we're doing this to prevent further cases, the better the analysis, and also the better the recommendations in terms of Guyana's plan.
Remember to do your part to ensure that you do not put yourself at risk during this time. If you have a cough, fever, and difficulty breathing, seek medical care early, but call the hotline first. That's all for today. Connect with us on all our social media platforms, including WhatsApp, Facebook, YouTube, and Instagram, as we bring you the latest and important news related to COVID-19 and much more. Also, subscribe to our website, dpi.gov.gy. Your Bird Report is up next. Stay safe and goodbye for now.